everybody, and welcome to this training on how to effectively integrate brief tobacco interventions. Please take a moment to read this disclosure and acknowledgements. All references to this presentation to tobacco and tobacco products are referring to commercial tobacco and not the sacred and traditional use of tobacco by some American Indian communities. So with that being said, I'd like to begin our training by introducing ourselves. My name is Natalie Pena, and I have been working in tobacco prevention for over 7 years. I recently received a certification as a tobacco treatment specialist. In addition, I formerly worked at the American Lung Association as the director of programs, where I managed a statewide initiative on smoke-free living.
Hi, my name is Rebecca Padilla. I serve as the National Manager for Tobacco Programs at the American Lung Association. I'm a certified tobacco treatment specialist, and I serve as a content expert for cessation across the country, providing technical assistance to state departments of health, tobacco control programs, and health systems in their efforts to advance tobacco treatment services in their community.
All right, so let's get started. Today, you are going to be able to describe proven evidence-based tobacco interventions, feel confident to make brief interventions, including AAR and the 5 A's, which we will go over later on in the presentation, be able to describe referral processes to community-based tobacco treatment service providers, and provide a list of resources both locally and nationally, and make recommendations based on the patient's needs. In addition, at the end of this training, you will be able to understand evidence-based tobacco interventions, understand motivational interviewing and its importance, understand how to make proper referrals to patients for treatment, and also understand the available resources both locally and nationally. So first, we will cover the need for brief interventions. Then we will go over the strategies of brief interventions. And last, we will cover approaches and resources that are available. Rebecca, do you want to get us started?
Yeah, thanks, Natalie. So considerable disparities exist in the prevalence of smoking across the US population, with higher prevalence rates in some subgroups. Similarly, the prevalence of key indicators of smoking cessation, things like quit attempts, receiving advice to quit from a health professional, and using cessation therapies also varies greatly across the population, with lower prevalence in some subgroups of the population. So you can see on the screen some of those rates that differ amongst different groups of people.
Awesome. And despite the overall declines in prevalence of adult cigarette smoking, people living with mental health conditions have a higher rate of smoking. So in the United States, 30% of all cigarettes are consumed by individuals who live with behavioral health disorders. 1 in 3 people in the US who smoke have a mental illness diagnosis. And the research suggests that smoking prevalence among US adults with mental illness or serious psychological distress ranges from 30% anxiety or depression to 62% schizophrenia, compared to 16 to 17% among adults with no such illness. Every year, smoking kills about 200,000 people who live with behavioral health conditions. Also, smoking affects the breakdown of medicines in the body. So smokers often need to take higher doses to get the same result as someone who does not smoke. If they quit, they can actually get the same treatment results from lower doses of psychiatric medications. So how do we look, how does New Mexico compare with the US? Adult smoking prevalence in New Mexico continues to track closely to the US rates. So about 1 in 6 adults. In New Mexico, adult smoking has declined significantly from 21.5% in 2011 to 17.5% in 2017. And I'd like to say that we can attribute that to the great work of the tobacco control programs here in New Mexico and other amazing partners working on strategies to reduce the toll of tobacco in our state. So we saw some great news from the 2020 Surgeon General's report. Nearly 70% of adults who smoke say they want to quit, which is really awesome. Each year, over 50% of adults who smoke try to quit, and more than 3 out of 5 US adults who have ever smoked cigarettes have quit.
That's right. However, the Surgeon General's report also presents findings that underscore the challenges that we face in further reducing those smoking rates. Some of these challenges include about over 40% of adults who smoke don't receive advice to quit from a healthcare professional, and that includes behavioral health professionals. Fewer than 1 in 3 adults who smoke use cessation counseling or an FDA-approved quit medication when they try to quit. Fewer than 1 in 10 US adults successfully quit smoking each year. And although a majority of cigarette smokers make a quit attempt each year, less than 1/3 use cessation medications approved by the US Food and Drug Administration, the FDA, or behavioral counseling to support those quit attempts. And that's really important for sustained, successful quit. So really what we want to look at today is how do we increase those successful quit attempts? And we have some really great strategies to share with you. So really let's think about what works to help people quit. We know that an evidence-based treatment plan that includes FDA-approved quit smoking medication plus behavioral change counseling works best. And we know that here in New Mexico, we offer comprehensive treatment for Medicaid enrollees, as well as those folks that have insurance as well. So in New Mexico, we cover all 7 FDA-approved quit medications, and we cover cessation counseling, including multiple provider types. We'll talk more later on in the training about these different quit medications and how we can access different cessation counseling types in New Mexico. But quit rates really do increase when people in the community consistently identify and help people quit using tobacco products. And we can do this through brief interventions. So that little bit of brief counseling is really effective for facilitating quit attempts. So if you do choose to help people in your office, in your community, quit smoking, there's lots of great community-based services out there, and we're going to go over those with you and really let you know how you can help people in the community today.
Awesome. So let's look at how we can help people quit with proven effective interventions. So why are brief interventions important? So brief interventions are important and effective. They have been shown to increase the number of quit attempts and the number of people who quit for good. They can identify if someone is ready to quit and provide them with support. The US Department of Health and Human Services released their clinical practice guidelines for treating tobacco use and dependence in 2008. And it outlines both the how and the why in step of their intervention process. So let's look at these brief interventions and how and why. Rebecca?
Yeah, be happy to start talking about these awesome brief intervention models. Really quickly, though, I want to go back to some really great statistics to share with all of you. So, got a very simple pie chart on the screen right now that outlines people who aren't ready to quit, people who might be thinking about quitting, as well as people who are ready to quit. So, this is based off of a national survey. And if you look at those numbers, 40% of people are thinking about quitting and 20% are actually ready to quit. So that's about 60% of the population that uses commercial tobacco products, that we could really address their tobacco product use with brief interventions. So that's a lot of people that we could really help in just a couple of minutes. So remember, we're focusing on those folks that are thinking about quitting and those that might be ready to quit. The people that aren't quite ready to quit, they'll get there eventually, and they'll know through these brief interventions, they'll get some education about how they can go about getting support when they need it, when they're ready. So the 5A's framework, 5A's stands for ask, advise, assess, assist, and arrange. This is a widely recognized evidence-based intervention for tobacco cessation. So these 5 A's are outlined on the screen right now, and this is really the gold standard of a brief intervention. We're asking each and every patient about their tobacco use status at every visit and recording their response. So this could be true if you're in a medical setting. We use this as a vital sign in medical settings, right along with taking someone's temperature or their blood pressure. We ask them about their tobacco use history. It can also be done, though, in behavioral health settings or other community-based settings where you might be giving someone support, doing an intake form, or providing them with other services that you could stack this onto to help better their health. So again, we're asking each and every person that we're dealing with about their status of tobacco use at every visit, and we're recording that response. If we do find out that they use tobacco products, including e-cigarettes or vaping devices, we do a brief counseling. So this is the advice. So this is clear, non-judgmental, and personalized suggestions to help them quit. So sometimes telling people that you understand that quitting is difficult and challenging, but that it can be done and that there's services out there to help them, that might be all you need to tell them. You know it's tough, but you're there to help. That's really all they need to know to get started. Assess is the person willing to make a quit attempt that day? So once you assess if they are or aren't, then you can assist the person to find either counseling and or FDA approved quit medications, and you can arrange to schedule a follow-up with them in a few days or a couple of weeks or even at the next contact point, just to check in with them and see how their quit attempt is going. So this whole process is brief. It takes less than 5 minutes. However, after several years of working on this, we've found out that those brief interventions that may just take a couple of moments needs to be even briefer. So we've come up with the ask, advise, and refer. So this was outlined in that 2008 report that Natalie spoke about a few minutes ago. So this is another evidence-based, proven effective, brief intervention for tobacco product use. So we're taking that framework of the 5 A's and we're boiling it down to something even more brief with the ask, advise, and refer. So again, we're asking everyone we have contact with if they use tobacco. So this is every person at every encounter. Simply asking, do you smoke or use any form of tobacco? That's all you have to ask. You then advise them. I know quitting is really difficult, but it's really the single best thing that you can do for your health. So are you willing to give it a try? Hopefully they say yes, and then you can refer them to the multitude of different cessation counseling services and treatment services that we have available in the community.
Awesome. So thank you, Rebecca. Brief intervention has been shown to be effective even when time or logistics do not permit comprehensive tobacco cessation counseling. This process can be done in just a couple of minutes. Ask about tobacco use, advise tobacco users to quit, and refer the patient who are willing to quit to the quit line or other community-based resources for tobacco cessation. So what does it sound like? And Rebecca said it earlier, and we're going to continue to say it throughout, is ask, do you smoke or vape? Or use any form of tobacco product. And then again, saying, I know that it's tough, but the best thing that you can do, it's the best thing you can do for your health is to quit. And are you willing to give it a try? And then you refer them to the quit line. So you can say the quit line would be happy to help you quit smoking. You can reach them at 1-800-QUIT-NOW or quitnownewmexico.com. If it's okay, I'll give them your name and they'll reach out to you about quitting.
Yeah, so it's really simple, but we're going to break it down even more for you just so we can get used to doing this, get comfortable with doing this. And, something I always recommend, Natalie, for you to do, since you're a newer tobacco treatment specialist, or for those that are watching the training, is practice with your friends. Make a little game out of it. If you have a family member that uses tobacco products, it's a great opportunity to both practice and maybe help them quit. So we're going to talk about that first A in AAR, and that's the ask. So really want to stress here that it's important when we ask about tobacco use that we use a tone that conveys sensitivity to the people we're working with. We want to show that we're concerned, but not that we're judging their tobacco product use. So keeping it very simple, monitoring the tone of voice that you're using and making sure that you're not giving other perhaps judgmental nonverbal cues like kind of scrunching your face or changing your body language that might make them feel defensive or like they're being judged is really, really important to keep in mind here. So simply asking, do you smoke or vape or use any other types of tobacco or nicotine like e-cigarettes is really simple. It takes practice though. So again, I highly recommend that you practice asking this question in a tone that makes sense to you, in language that makes sense to you. A really simple question, right? And you can follow that up with, we care about your health and we have resources to help you quit. And memorizing a simple statement to follow up that question is really important. I know in my experience, a lot of times people might ask, why are you asking me if I smoke? Especially if they're not in a medical setting. So simply stating that you care about their health and you know about resources that can help them quit if they're interested is really important to again convey that sensitivity, that concern, and to show them that you're not judging their tobacco product use. Another way that you can ask people when you're following up with them outside of that initial intake is asking them at each follow-up visit if anything's changed with their smoking status. So this is true if someone is identified as a tobacco product user and perhaps the last time you saw them, they just weren't ready to quit, or if they identified as a non-tobacco product user. We know sometimes that people are not forthcoming sometimes about their tobacco status when they're first asked about it. So they might feel more comfortable at their second, third, or 10th visit with you. And they might divulge at that time, you know what, I have been a smoker, but I'm trying to quit. And then you can follow up with them and speak to them a little bit more about how you might support their quit attempt. Another thing is we know sometimes things change in people. Stressors happen, and they might resort to tobacco products, nicotine dependency as a means to cope with stressors in their life. So again, asking every person at every contact, at every visit is really important to make sure that you're identifying people that might be able to quit. The next A in AAR is advise. So after you've asked, you're going to advise tobacco product users to quit. So the really important thing here is to make your message clear, strong, and most importantly, you're going to make it personalized. So how do you do this? Getting to know the person that's sitting next to you or sitting in front of you is really important. So you can do that through the intake process. But the important thing is that you're stressing that quitting is the most important thing that they can do for their health and that you can help them quit. That's really the key takeaways here. It's important for their health and you can help. So I have a few examples on the screen right now. Quitting is the most important thing you can do to fill in the blank here. So if you know the person you're working with maybe has asthma or diabetes, all of these things can be impacted by quitting and impacted in a positive way. The other thing that you can stress is that quitting is the most important thing that someone can do to protect their health both now and in the future. And you can say things like, I can help you increase your chances for quitting successfully, or we can find additional resources to help you quit. So we're going to talk more about those additional resources shortly. But again, really important to stress that It's doable, it's important for their health, and again, that you are there to help them quit. And finally, most people who are willing to quit don't really know the extent of the behavior change options and the counseling options that are open to them in the community. So, simply informing people about the choices that they have can be a powerful intervention. And this can be done really in less than a minute. So, you should compile a list of different smoking cessation programs in your area, and we'll go over those to help distribute them to the people you work with. As a matter of fact, the New Mexico Department of Health has a really great little menu of cessation options. It's the New Mexico Cessation Options at a Glance, and it's available in both English and Spanish. You can download it for free. It is really a great, one pager that you can hand out to people that might be interested, or even have it hanging out in a waiting room on the front desk, or even link it on your website. So again, looking at different referral options might include referring a person to a doctor, a nurse, a pharmacist, or even another clinician for additional counseling or medication. It might also look like referring the person to a local group or program, or to a text or online program, or to the quit line, or you can combine these for really lots of options. You can always combine referring someone to their doctor along with referring them to the quit line.
Isn't Rebecca amazing? Thank you, Rebecca, for all of that information. I call her the expert on this stuff. So now we're going to go over some community resources. So the folks from our practice scenarios are ones who would benefit from the support of the Quit Now New Mexico and other community resources. So quitnownewmexico.com or 1-800-QUIT-NOW. You can go to either one for those resources by phone or web-based services. Free help to quit all tobacco and vaping products. There's 24/7 support. There's a personal quit plan. There's self-help materials, unlimited sessions with a trained quit coach. Also, they have nicotine replacement therapy such as gum, patches, lozenges, and it says while supplies last, so they will determine that as the person calls. Shipping mail directly to the registered participant, and specialized services for youth, pregnant people, and they have multiple languages as well. So as you can see, Quit Now offers different cost plans that give people different options to choose from that will work best for them. These options include the helpline, a web coach, and individual services.
That's right, Natalie. And again, these are all available at no cost to all New Mexicans. So again, you can access these services at any time, 24/7, by calling 1-800-QUIT-NOW. And that's our national quit line number. So that works in all states, no matter where you're at. You can call them 24/7, and they will get you to a local quit coach that's ready to help people quit. There's also quitnownm.com. And as Natalie mentioned on the screen, there's the three kind of overarching categories of what can be accessed at quitnownewmexico.com. So the helpline, the web coach, and individual services. Natalie, do you want to walk us through each of these kind of three categories and let us know what's available in each?
Absolutely. And please chime in. So we have phone-based services. Enrollment for English, 1-800-QUIT-NOW, as you can see, and the numbers on top if you can't translate it on your own. Then we have the free options include the 24/7 support, a personal quit plan, self-help materials, and unlimited sessions with a trained quit coach. Rebecca, do you have some more information on how the quit coach works?
Yeah, we do. And actually, we'll talk about that a little bit more in just a couple of minutes. But the quit coaches are amazing. They're really experienced, highly trained professionals, and a lot of them are former tobacco product users themselves, so they know what it's like to go through the recovery process. They're really nice, they're very supportive, and I think you've mentioned a couple of times now, they have different language services available too. So if someone is a little bit more comfortable speaking in Spanish, We have lots of wonderful trained tobacco treatment specialists ready to help them quit in Spanish.
Awesome. Thank you, Rebecca. So we also have web-based services, and it's quitnownm.com. And they have 24/7 support as well, personal quit plan. Again, you can chat with a trained quit coach. They have self-help materials, and then they provide nicotine replacement therapy. They do actually go through a process for that. Rebecca, do you want to touch on that just a tad bit?
Yeah.
We'll go over this in a training in the future, but if Rebecca, you can go over that just a little bit.
Yeah, absolutely. So whether you're accessing these quit services through 1-800-QUIT-NOW or through the web-based services, your quit coach is going to assess the person that you've referred to them. So they're going to look at what tobacco products they use, how long they've been using them, and how frequently they're using those products. And based on that, along with some additional information that they'll gather from the person that's calling, trying to quit, they'll assess them and see if they're eligible for a quit medication. And if so, they'll work with them to find the right form of quit medication that'll work best for them. And again, great, here in New Mexico, if you are deemed through that assessment to be eligible for a quit medication, they can mail it directly to the person's home to get them started with that medication support to really help give them the best chance possible on a sustained, successful quit. And one of the great things about quitnownm.com, about the web-based services that Natalie was just talking about, is these are really awesome for people that kind of want to just dip their toes into quitting, if you will, and kind of take it a little bit more self-paced and just look and see what might be available. And for those folks that are kind of on the fence about quitting, this is a great option. It's very low pressure. They can do it at their own time, in their home, on their phone, laptop, iPad, at work, at home. It doesn't matter. They can access it anywhere. So it's really great. And, there's no wrong way to reach out for support, really. You can use both 1-800-QUIT-NOW and the web-based services as well.
So I love that, in their home or on the phone, and it rhymes. So they also have text messaging support. Both phone and web participants may also take advantage of up to 300 messages tailored for the participant's personal quit plan, quit coaching call reminders, so they can't get out of it, motivational and educational reminders. And then they also have a la carte services where they can do text messaging to receive tips, games, and reminders, a free 2-week starter kit of patches, gum, lozenge, and then also a practical and resourceful quit guide. And then a series of emails full of tips, advice, and encouragement to help them quit. And then also the phone-based services recommended. Is there anything else that you want to touch on here, Rebecca?
Yeah, the text messaging support is one of the newer services that's available through our quit lines across the country. And it's really awesome. It's very successful. And it's really great for when folks are having one of those really intense urges to pick up that tobacco product again. So they can check in via texting back through that text portal. They can, text in a code and get a quit tip. It's really great to kind of give them that encouragement, those reminders. And it's awesome for those folks sometimes that may not have the support network that they need to help support them quit. It's like having a virtual friend right across on the other side of the phone for you to send you some, uplifting, helpful, evidence-based quit tips. So I love it. It's a great addition.
I agree. And I think it's scary for some people. So that's kind of nice. I know I like to text.
Yeah.
So it makes life easier.
Absolutely. And it shares lots of great tips, and it does kind of make it more fun. So I know a few minutes ago, we briefly talked about our amazing professionals that work at our quit lines across the country. Natalie, do you want to tell us a little bit more about them?
Sure. And feel free to chime in if you have anything else to say. So if someone is thinking about quitting smoking and would like some help, a quit line might be just what they need to succeed. So a lot of people don't really know what quit lines are or how quit lines work and what to expect. Quit lines provide free coaching, over the phone to help people quit smoking and using other tobacco products. So when you call 1-800-QUIT-NOW, you can speak confidentially with a trained quit coach. And I like the word confidentially because some people don't want to have all of their information out there, or even they're afraid, right, about quitting. So the confidentiality is really important. Quit lines provide many of the services and similar support you can get in a stop smoking class or from your doctor. And it could be a valuable complement to your doctor's care. Um, and sometimes, and with these brief interventions, that's what we're saying. How do we add additional services to support the individual as well? Quit lines are available throughout the United States. Coaching can help. Coaching help is available in several languages, which is important. And people can get support through the Quit line with information on how to deal with cravings, withdrawal, how to get the right kind of help from friends and family, what website, apps, and texting programs might help them quit. There are other services out there as well, on whether to use quit smoking medications and how to use it. And best of all, quit lines are proven to increase your chances of quitting successfully and staying quit. A quit coach will work with you to develop a plan that is personalized for your needs. Also, quit coaches are trained to help people quit. They understand what people who are quitting are going through, which I think makes it very personal. They are trained to be good listeners and give callers encouragement, support, and helpful tips. And as we know, sometimes people just want to be heard when they're wanting to quit. A quit coach will ask questions to find out what type of help the person is interested in. They will also ask about their past experience with trying to quit. This information helps them give useful suggestions on the type of program that could work best for them. Quit coaches can help connect people with FDA-approved quit smoking medicines through your health insurance or community programs as well. They may also be able to provide them with these medications for free. The best way for people to learn about what's available for them is to connect them to a quit coach at Quit Now NM.
That's right. Yeah. And Natalie, you said something that really kind of piqued my ears there for a moment, and that is the quit coach is asking people about their past experiences in quitting. So we know on average, it takes about 7 tries on average for a person to quit and stay quit. So that's something, a lot of times you'll hear as you start to make these brief tobacco interventions is people saying, well, I tried to quit and I couldn't, or I tried to quit and I started again. So it's really common that people have to keep quitting. So there, again, is no wrong way to reach out for support. So whether it's their first time trying to quit or their first time this week trying to quit, we can always help them with lots of support out there.
Absolutely. Yes, it is difficult to quit. And I've had many in the past when I was working with individuals in the community. There were people who actually would reach out and say, I've tried to quit, I'm not going to quit anymore. So I think it's always important to keep asking and letting them know, like, it's going to take multiple times. And it's like any habit, right? You build it up and it's like building muscles. You have to keep doing it. So I agree. So these comprehensive cessation services provide support to New Mexico who want to quit using tobacco. Also, free nicotine patches, as we said before, gum, lozenge, as appropriate, can be provided to register Quit Now NM participants, along with free quit support outlined on the screen. Working with a quit coach through New Mexico, through Quit Now NM, the folks can they can quit at their own pace, conquer their urges to use tobacco products, use quit medications to safely and effectively address recovery symptoms, as well as utilize a program based on more than 25 years of research.
That's right. And on the screen, you'll see kind of a breakdown of what's included and what's not included in each of these 3 portals that's available on quitnownm.com or through 1-800-QUIT-NOW. So helpline, web coach, and those individualized services are outlined there on the screen for you. So, in addition to all of the great services at Quit Now NM that we just outlined for you, there's also the CDC. So, the Centers for Disease Control and Prevention has an awesome quit smoking website that addresses all tobacco products. So, that's quitting everything from cigarettes to smokeless tobacco like dip or e-cigarettes. These resources are both for you as a person in the community working to help other people quit, as well as resources for those people that you're trying to help quit. So these resources include information on FDA-approved quit medications, the different medications that are available, how to access them, the risks and benefits of each one. It also includes tailored information for specific groups of people, including people in the behavioral health community. And it has lots of support tools for quitting as well. And these are all available at no cost, 24 hours a day, 7 days a week at cdc.gov/quit. So this is a little snapshot of the cdc.gov/quit website page. There's great videos on there. There's specific information for providers, for prescribers, for people trying to quit, as well as even for family members. So if you're out there and engaging with people and you ask them, if they're a tobacco product user, do they smoke, do they vape? And they say, no, but my partner does, and I'd really like to help them quit, you can still refer them here to give them great tools on how they might be the most supportive to that person in their life that might be trying to quit. We also have some great resources at the American Lung Association. So again, these are resources for you, things like toolkits, billing guides if you're a provider, and cessation coverage info for New Mexico and all states are available at lung.org. You can also get additional trainings and certificates, many at no cost at lung.training. And for those that you're helping, we have really great educational information, fact sheets, cessation support, and more, all available at no cost at lung.org. We also have lots of health information on everything from clean air to lung health available at lung.org or via 1-800-LUNG-USA. So Natalie mentioned earlier that no matter what we're doing here with our practice scenarios, all of those folks will be able to benefit from the great services that we've just outlined for you that are available in our community. So I think it would be really helpful in the last few minutes that we have together in this training today to go over some common scenarios that you might encounter when you're in the community and working with folks and integrating this brief intervention into your workflow. So are you ready, Natalie?
Yes. Okay. I am ready. So I'm going to go ahead and introduce. We're going to meet Chris. Okay. She quit smoking 7 years ago, but picked up e-cigarettes use last year. And here's what she states. It's great. I can puff on it throughout the day, just about anywhere I go. I can vape shop. The vape shop owner told me that it's harmless water vapor and nicotine. She's excited to finally be able to enjoy nicotine without impacting her health. She's experiencing frequent asthma attacks more often. Doesn't think quitting is necessary, but will listen to what the practitioner has to say or what you have to say. Motivators are 2 young children at home who always comment on her vaping. Barriers, don't feel e-cigarettes are harmful. So Rebecca, can you walk us through the scenario, what you would tell her if she came into your office?
Yeah, so people like Chris, a lot of times we hear this very commonly that they have been misinformed that, vape products are harmless, that they're just water vapors. So this is really that teachable moment where you could engage with Chris and really let her know that e-cigarettes, vape products, just like cigarettes, are tobacco products, are nicotine delivery products that impact our health in a negative way, and that it is possible to quit those. So something important here is that Chris quit smoking some time ago and then started using e-cigarettes again. So you might want to ask, what happened a year ago that you picked up e-cigarettes? What was it? What was that stressor that prompted her to go back to that dependency, back to that addiction? So the important thing here is stressing that Chris has quit before, so she knows how hard it is. You might want to talk to her about how she quit in the past. You might want to let her know that there are lots of tools available to help people quit, including quitting e-cigarettes. So again, we've asked, she's open to it. So let's get Chris connected with all of those great services that are available in the community. So one of the things that she's got really motivating her is those two young children that are at home that always comment on vaping. So sending her to cdc.gov/quit or to lung.org and getting some of those really great educational, informational one sheets, or sending her to those websites can be really helpful to show her that her kids are watching her. And now it's more important than ever to model good, healthy behaviors. So sending her to those to get that extra information and education might further motivate her to quit. And when she's ready to quit, you can send her to Quit Now NM.
Awesome. Thank you,
Yeah.
Rebecca. So we'll go through the next scenario. Meet Tom. He is a 62-year-old male, smokes 3 packs a day. It keeps him alert while he drives his truck for 14 hours each day. He's been wanting to quit for a while, been meaning to try e-cigarettes to help him quit. He heard that they can help. He's a type 2 diabetic and currently takes oral medications. Blood sugars have been high lately and he's concerned. If he has to transition to the injectables, he will lose his trucking job and be unemployed. Motivators are keeping his blood sugar managed. Barriers: works long hours and not sure how to keep himself busy while driving his truck.
Yeah, so it sounds like Tom has a lot of stressors, right? So looking back on this, Tom has been heavily smoking. So 3 packs a day of cigarettes, that's 60 cigarettes a day, which is an incredibly high amount. So, if Tom got referred to a quit line or to his provider and they went through an assessment with him to identify quit medications that might work for him, there might be several quit medications that could help for him here. There might even be combinations of those quit medications that might be useful for Tom. So really stressing to Tom that there's tools out there, tools and medications to help him quit. He didn't start smoking overnight. He didn't start smoking 3 packs a day overnight. So it's going to be a process to quit. Letting him know that it can be done. It looks like he wants to quit. And this is another teachable opportunity here. He said that he thinks e-cigarettes might be able to help him quit. So again, this is that teachable moment where we can let them know, you know what, e-cigarettes are not FDA approved as a quit smoking device, and that they actually sustain and can increase that addiction and that dependency to nicotine. So the best thing that Tom can do to support his health is to quit and not just switch to another tobacco or nicotine containing product. So using those quit smoking medications could be really, really helpful for him here. He is motivated by his health, obviously, right? He doesn't want his diabetes to get any worse. So you could really leverage that and capitalize on that motivation to do the best he can to promote his health, and remind him that quitting smoking, not switching to vaping, is going to be overall the best thing he can do, not just for his diabetes, but for his overall health. And, one of the barriers that he has is working those long hours, and he's not sure how he's going to keep himself busy. He could actually schedule quit calls around his work schedule. And that's what's really great about leveraging and using the quit line is doesn't matter what his schedule looks like. He could still get that one-on-one support, have a conversation with a real person on the other end of the phone that knows what he's going through and that's there to help him. So, really exciting to meet people like Tom in the community, people that have been using these products, have a high level of dependency, but are still willing to do things to help their health. So, super important to keep talking with folks like Tom when you meet people like this in the community. Yeah, it's a great one. Thanks.
Awesome. Thank you. Okay.
So, I'll take us through this next scenario. So, I'd like for you all to meet Amir. He's 36 years old. He smoked about a half a pack to a pack a day for 20 years, but he was able to quote unquote quit by switching recently to e-cigarettes. And he's using a pod device. So he reports using about 2 to 3 pods a week. And Amir is really motivated by the 2 kiddos at home. He's got an 8-month-old and a 4-year-old. And he mentions that those kiddos were the first, real main reason for him to quit smoking. And he loves being active with them. However, right now, Amir doesn't really feel like using a vaping device or that e cigarette is really negatively affecting him in any way. And he reported that it, quote, helped him quit smoking. So this can be a really tough scenario to address. So, one of the things I really want to point out with Amir is Amir's 36 years old, but smoked for 20 years. That means that he started smoking when he was a teenager, and we see this more often than not. We know that when teens start using tobacco products, whether it's cigarettes or e cigarettes, they have a higher degree of long term use than people who start at a later age. So, that's why we have worked so diligently to increase the age of sale. We now have it increased nationally to 21 in order to try to help protect young people from starting on that course towards tobacco and nicotine dependency. So Amir, back to our practice scenario here, he reported that he quote unquote quit smoking by switching to e-cigarettes. And the key here is that he switched to e-cigarettes. He didn't really quit. So it's important to educate Amir that e-cigarettes and vape devices, those little pods that he's using, have nicotine in them. He's inhaling them, which can impact his lung health, and also educating them that if he's using around his kids, around the kids in his home, that he's exposing them to secondhand aerosol from those devices, which could impact their health. And he's also modeling that behavior towards them, setting them up to, again, be more likely to use those products when they get a little bit older. So it's really important to educate him that the best thing that he can do, not just for his health, but for the health of his kids and the future health of his kids, is to quit tobacco products in general. So that includes those nicotine delivering devices like Juul or e-cigarettes or those other closed pod devices. So really leveraging his kiddos and staying active and healthy is the best thing you can do to help motivate him, and really stressing that education that e-cigarettes are, tobacco products. They're made by the same industry that makes cigarettes. They can negatively impact his health. Another motivator here could also be the cost associated with using those products. So that's another thing you could highlight when you're advising someone on why it's important to quit, getting them to look at the cost, the financial cost that they're spending every week on these devices, and how they could better use that income that's being spent on something else. So let's look at our next practice scenario. Natalie, do you want to introduce us to Megan?
Yes, so this is Megan. She's 24 years old and pregnant. Previously smoked 1 pack per day up until her second trimester, and now uses the Juul along with real cigarette only once in a while when her 2.5-year-old toddler acts up. Reports that she feels guilty when smoking while pregnant, but with stress of having a toddler, what can I do? Motivators. She's pregnant, new baby on the way, 2.5-year-old son. And barriers, smokes a way to deal with stress, and has been prioritizing her smoking as me time.
Yeah, that's really hard. Obviously, a young pregnant person with a toddler at home, there's lots of stressors there. So, again, talking about the importance of really making sure that Megan understands that the best thing that she can do for her health, for the health of her baby that's on the way, and the health of that kiddo that's at home, is to quit. And that means quitting both e-cigarettes and those quote unquote real cigarettes. So those combustible cigarettes that she still sneaks in here and there. So it sounds like Megan's got a lot of stressors in her life and that she's falling back on that dependency on nicotine as a means to cope. And we see this all the time. And we see this with substance use dependency across the board, whether it's alcohol, opioids, or nicotine. People resort to these as maladaptive coping mechanisms. So this is something that we could really look at getting at the root of the problem, which is the stressors, and building in some support, letting Megan know that you understand that it's stressful and that there's people that can help her. So this is a great opportunity to refer Megan to a quit coach. And I would highly recommend referring Megan to calling a quit coach and actually speaking to someone one-on-one. One of the great things that we have in New Mexico and across the country is tailored quitline services that are specific to pregnant folks and to new parents. So they have tailored programs that really uses real world scenarios and real world effective tools to help people quit no matter what they're facing at home. So, integrating and tailoring their quit experience to what they're experiencing in life is really key for folks like Megan.
Thank you, Rebecca. As you can see, there's a lot of great information and support. So now we're going to go to Tanya. She's 16 years old. She vapes to and from school in her car and on breaks at work and in the evenings, where she works as a server in a restaurant. She reports that she doesn't think it's harmful, that it's just fruity, quote unquote. Both of her parents smoke, and she says she hates smoking because it is so gross and smelly. She has never tried quitting before. She doesn't consider herself addicted and is unsure of how much nicotine is in the e-juice she uses in her vape. Her motivators are she cares about her complexion, likes being independent, takes pride in being good in school and having a good job. Some barriers reports that vaping is no big deal. All of her friends vape and they're just fine.
Yeah, so this is really tough. So when we look at supporting younger folks in quitting, especially in quitting e-cigarettes, vaping devices, these emerging nicotine delivery devices, it's really hard. And a lot of them don't associate the products that they're using as having a health impact the way that smoking does. And with this person, with Tanya, Tanya reports that both of her parents smokes and she hates it because it smells bad. And that's something we hear a lot of times when we're doing interventions with young people. They don't like the way smoking smells, so they would have never gone that route, but they picked up a vape. So really important here to again stress that these are products that are made by that same industry that's preying on her health, wanting to get her addicted, and wanting to really get her control over her life, over her paycheck, over her future. So it's really important to, acknowledge that Tanya has a lot of control over her life right now, and she can take back even more control by giving up that e-cigarette, and that there's ways to do it. So there are really great tailored evidence-based quit programs that are specific for young people. And you can access those quit programs for youth by going to the same resources that we've talked about before, Natalie. So looking at Quit Now New Mexico, looking at lung.org, or going to cdc.gov/quit. And you can get in touch with those great resources that are tailored specific for young folks and specific to people that just use e-cigarettes. So a little bit of a different approach. And really looking at those same motivators and barriers. So it sounds like because Tanya's kind of surrounded by friends that also vape, it's really important that she has other support systems in place. So that's where getting her in touch with a quit coach can be really impactful. Getting her into that text portal so that she can get text information and text support can be crucial as well as staying connected with her as a referral source in the community, reminding Tanya that you're there to help her, maybe checking in with her periodically to see how her quit is going. Yeah.
Awesome. Thank you. Yeah, and I know it's a little bit different with the teens.
Yeah, different motivators, different challenges, different stressors. So the great thing though, again, is that we have so many tailored programs available for free in our community that we can really address people where they're at today in quitting that nicotine product. So again, going back to that ask, advise, refer, the AAR, just a little reminder here, we're asking every person at every visit if they're using a tobacco product. We're advising them through brief counseling, letting them know that we know it's tough, we know it's going to be good for their health, and we're there to help them. And then referring them, if they're willing to make a quit attempt, to one of those great evidence-based, community-based resources that we've talked about. So really, through addressing tobacco use and nicotine dependency with the people that you serve in your community, you can improve health by working to incorporate brief tobacco interventions like ask, advise, and refer. So you can help those people in the community, you can improve their health in just a couple of minutes by integrating this brief intervention.
Awesome. Thank you for that. So I want to kind of go over the Nicotine Use Prevention and Control Program of New Mexico, and its partners use a comprehensive evidence-based approach to promote a healthy lifestyle that is free from tobacco abuse and addiction among all New Mexicans. NewPAC follows recommendations from the Center for Disease Control and Prevention. NewPAC works with communities, schools, and organizations across the state to implement activities and services that decrease the harmful and addictive use of commercial tobacco outside of its traditional sacred or ceremonial purposes. This will reduce tobacco-related illness, save lives, and save money. Activities that encompass all of this comprehensive approach include community-based programs, school tobacco policies, cessation services, public awareness and education campaigns, incentives to reduce health disparities. NewPAC works to improve the lives by eliminating the harm from tobacco and the use and nicotine addiction using the anti-oppression framework and effective strategies that reach, involve, and mobilize individuals, organizations, and communities to develop policies, systems, and environmental norms that support nicotine-free lives. You can learn more about NewPAC by visiting newpacnm.com. That's NUPACNM.com. Also, for more information, you can reach out to us at www.consolationnm.com. This training was provided by them, as well as you can reach out to www.nmhealthequity.org. And the information is there at the bottom. So we'd like to thank you for coming to this training. We have another training coming out very soon. Rebecca, do you want to just give us a little brief on what's to come for our next training?
Yeah, so on the next training, we'll be diving a little bit deeper into those 7 FDA-approved quit medications, how they work, where people can access them, and who they might be best for.
Awesome. So we're excited to see you at that. So I would say please click on the link below to submit your post-training assessment or evaluation. Once that is complete, you'll receive an electronic certificate of completion. Thank you for your time, and we look forward to your attendance at the NRT training to come. Thank you so much, Rebecca, for all of your help.
Thank you. This is great. Thanks, everyone.
Bye-bye.